Let's talk a little bit about what's been happening over the last few weeks.
Well, I think I was good for a while, working out for almost a month. And after the month, started crashing again, getting sick all over again. Just like a repeating cycle. So I quit doing everything, even putting content and everything. I was just exhausted and pretty sick.
Mm-hmm. Absolutely.
Yep.
So Monday, we're going to look at the idea of a feeding tube for supplemental nutrition to get you through these times when you can't eat. Because being sick all over again, what you mean is that you were back to the vomiting, back to not being able to hold food down, liquid down. We're back to hydration every week. So basically, we're
back to square one.
And this keeps happening. This is also a cycle. So every few weeks, you like you said, you go on for a month, maybe 3 at the longest. That you're good.
I'm not still 100% though.
Right. No, you're definitely not 100%.
The whole time.
No.
And if I don't force feed myself, I'll be under probably 130.
I've never known someone who can literally vomit and then go immediately into the kitchen and eat. It's
crazy.
Yeah, it's crazy.
It's a never-ending cycle. The only thing is, I think the only thing they do to something is I have to get that sick.
Right. That's
in
the
order,
unfortunate part.
And it's horrible because I don't want to be, because I've been there before. So sick,
right.
Dehydrated, where everything was going bad, you know?
Right. Kidneys, liver function, all those things that are still not perfect are definitely not benefiting by you continuing with this cycle. You can't eat, your iron gets low. It's just a vicious circle. Vicious circle.
At least this, it would help. At least so I'm not forcing myself to eat all the time to get nutrition in me.
Right, the feeding tube.
Where I keep drowning, where I just start getting so tired, I can't keep up, and then I get sick and crash. And
right, here the warm weather's coming in to be nice just to be able to take a car ride. I don't think people realize that life stops in every facet. So we don't even go out to eat anymore because there's no point in buying, even treating ourselves to a steak dinner or eating out, because you literally get to the car and before you're even to the car, you're throwing it up. So there's no benefit in even
it don't even matter what I eat, how much, the portion.
And going somewhere and just taking a ride or being in public or anything, you're burping constantly. You're sick.
And I think being sick too takes everything away from you financially. Everything just robs you from everything. Yeah. Going through this whole process, it's horrible.
Let's talk about something that people probably haven't thought about. What your oral health is like now.
Oh my God!
After the 6 years of
and I have pictures.
Vomiting.
I have pictures too of my teeth. Perfect.
Looks great. Yeah, you had a little grinding anxiety issue from grinding your teeth.
I think it's from that tumor too. A lot of it's from that.
Sure.
So it's not as bad anymore.
Right. The anxiety was.
But the damage is already done.
Tumor.
But my teeth. Wow. Yeah, they're.
Well, you can't have that kind of acid all the time.
I brushed and brushed and brushed and brushed, but when you're vomiting in your sleep and puking in your sleep.
Right. There's nothing you can do.
Nothing.
Yeah. I mean, there are times when you'll wake up and I know that it's on the sheets or it's on the floor, so I know that you're vomiting in your sleep. You've had numerous times when you were diagnosed with pneumonia.
Yeah.
From reflux in your sleep, from vomiting in your sleep.
Just cycles, just.
I don't think people realize the depth that this goes to. I don't even think your doctors realize the depth that it goes to, because there's so many of them that they're not all able to communicate. Not everyone shares their records freely on, all these, patient platforms, certain softwares. So not everybody's seen. I mean, we recently, guys, had the same medication prescribed for Ron for probably the 8th time.
Oh, yeah.
And what's sad is that no one has time to review his records before he comes in. So they're just acting as though he's a normal person coming in complaining of these things. This is far from normal. He doesn't have half a stomach. He doesn't have half of a pancreas. What is normal about that? And why are we starting from the position of normal?
From the Whipple surgery.
Right. Why are we starting from the position of normal after the surgery and going, oh, well, we're going to treat him like a normal person? There's nothing normal about this. There hasn't been anything normal about this.
There's been
since
so many drugs thrown at me. It's unreal. It's ridiculous.
I mean, we get the same, well, I shouldn't say we, that's not fair. Ron gets the same drug prescribed to him so often that we keep them, because as soon as he stops them, we see someone else and they make you start them. And if you don't play the game, and I know it sounds terrible to say that this is a game, because this is not funny. This is in no way entertaining. This is heart-wrenching to watch from the significant other's point of view, to not be able to help you. But what's worse is that there is a game here to be played. If you don't take the medication, if you in any way stand up for yourself and say, no, I've had that before and it didn't work. If they didn't prescribe it, they don't listen. It's like their ears turned off the moment you
this last
disagree.
time I just went when I got sick.
Yeah, the moment you disagree.
Remember, I went and I said, this is going to be a waste of time. And sure enough, I said this, and then here, how about these pills and these pills? And I'm like,
right. And we've taken everything from, appetite stimulants to anti nausea to, it doesn't matter in what way the anti-nauseas are given to you.
Exactly.
It's crazy. The anti-nausea drugs that he keeps getting, tell them a little bit about what happens when they give you anti-nausea medication when you're feeling
when you
have
I need
to
to
empty
throw
your
up.
stomach.
Yeah, and I don't, because then I'll suffer for 6 hours, if not longer, of not being able to throw up when I need to throw up. So I am suffering to go through this whole process that I can't throw up, where I normally would throw up.
And at least it would alleviate.
It would alleviate the symptoms of how I feel.
Mm-hmm. Like So
now
hiccuping, nausea, vomiting.
I'd say the last 3 days, miserable. I'd wake up fine, full of energy. Within 2 hours, 3 hours, I start crashing. I get tired, and then all of a sudden, I start feeling like crap. Like, what's going on? I don't get it.
Mm-hmm.
And in eating, it's like rolling dice to eat. That's horrible. That's freaking horrible.
Right, because you're at the point where you don't even want to eat because you know what's going to happen.
Yeah.
And then here comes that slippery slope, and we're down to 150, 160 pounds. And 150, 160 pounds with no muscle is not, it doesn't look good on anybody.
No.
It doesn't look good on anybody. Your face is drawn. Your skin is just hanging there over what little muscle you do have.
This malnutrition.
It looks like you're malnutrition.
Yep,
yeah,
and it pretty much is.
To coin a Ron Mercer phrase, I look like a crackhead.
Yeah. Teeth and everything.
But yes, the problem is that this is robbing you of all those micronutrients you're not getting in your food. It's robbing you of the iron that you're not getting in your food. It has to be doing things long term to your bones. Your nails are pitted and turning up from the lack of, from the anemia. I mean, this just is, it's like I talked about in the last video when we were on our way to do one of the endoscopies in Cleveland. It is so multi-layered. It's like an onion. Every time we pull back a layer, and I don't really think that the doctors ever go deep enough. Having to ask a doctor, hey, listen, we need a referral to get some sort of consultation for a feeding tube. Well, that's not my wheelhouse. But isn't it, though? Because when he's not eating, he's not getting the iron he needs, he's coming back to you to get an iron infusion. How is this not in your wheelhouse? Sometimes you feel like you're convincing someone of the job that needs to be done, and they're saying, yeah, but I'm not that someone.
It's nonstop.
The thing is I always thought that healthcare was like a group effort, and it's truly not. It's seeing one physician that isn't speaking to another physician who's a specialist who doesn't handle this thing, so you go to another specialist, but there's never a communication between all of them. There's not a single wire, or a single string that connects all of these components. So you as the patient are going back going, hey, I've already done this. And then they look at you like, yeah, right. And then you start the whole process over again. And it sets you back months and months and months and months. And what it means for us is where we live, we're driving 2 hours to get care one way.
Yeah, it's just ridiculous.
If we're heading to Cleveland.
It just adds up. Time, everything. The whole process of this.
And I know it's draining emotionally. I mean, it's draining emotionally for me to watch this. I cannot
I can see a lot.
fathom going through it.
I can see a lot for you too, though. Knowing you can't do nothing about it or whatever, and just...
No, it's terrible.
Well, hearing me sick and then nonstop burping, and just never ends. You know what I mean? It never freaking ends.
And I wonder what I can do to support you. I feel badly, when you're feeling badly, leaving you in bed, and here the summer's coming, and we usually put a garden in, and we usually clean up the flower beds, and doing all of those things. It's still getting done, but with your absence, and it was normally something we shared in doing, and
I was down really bad.
We can't even do that. We don't even share in that, and it really feels sometimes like it's pulling us in opposite directions too, and that not that we don't have a good strong foundation, not that we're not committed to each other, but it just feels like it's an obstacle between us two that even when we get a little bit combative with each other about it's time to go to the hospital, Ron. No, I don't want to go to the hospital yet. Well, you can't keep going on like this. Yeah, but I can't keep going to the hospital. Even that dynamic.
I know it, yes. A never-ending cycle, yeah. Because I can't stand going to the doctors. I can't stand going to the hospital anymore because it's just a circle. Well, when we go to hospital, it's just to get hydration because I'm so sick.
Yeah, pretty much. Hydration, sometimes they give you pain medicine. And the funny thing is the last hospital stay, guys, was the emergency room. We were there for a few hours, went in for hydration because he was feeling really ill, having a lot of stomach problems. And the woman doctor who comes in, emergency room doc, great lady, says, why aren't they giving you any pain medication for this? And there's been literally no pain meds given since surgery. At that point, it was you came home on a little bit to try to wean you off a little because you came right out of surgical step down.
What's that for? What?
Once you had your Whipple, you went into surgery ICU, then you went into surgery step down, and then you came home from surgery step down. You didn't even go to a normal floor before that.
Oh yeah.
And you came home on a little pain meds, but since November, first week in November of 2024, you have not had any pain medication, even though you have something that resembles what I would call jackhammer esophagus. And we can't even get a gastroenterologist who's a specialist in digestive disease
to get a diagnosis,
to say it's this or it's this.
Yeah, that's crazy.
And it's not an easy task to watch. I mean, I watch you melt when we're in the emergency room, when they prescribe the same medication again and they ask the same questions again, even though we're going to the same hospital where you were originally diagnosed with this tumor.
Yeah.
And it's I don't know how to say the healthcare system is broken, but it's really broken. And guys, it's what I do for a living. I work in healthcare, but it's broken from the patient standpoint of listening. Back in the day, I mean, we're 56, I'll be 56 in a couple weeks. I remember the doctor reviewed your chart. It was paper. They brought it in the room with them. And now everything's computerized, and that's fantastic. But
it is. It's so different.
It's layers and layers and layers of electronic information that's no longer something that they can flip a page.
Yeah.
And so they're no longer looking. They're no longer reviewing. Unless they've sent you for it, they don't have a clue what the next guy said. And they don't have time to stop in between and look. And for you, that means the same care that isn't working over and over and over and over again.
It's a vicious circle. Actually, we're going in a direction and telling the doctors, okay, let's get a check on this.
Right.
Remember? We're
Yeah.
checking for neurology, everything.
So back in 2024, when Ron had his Whipple surgery to remove the PNET tumor, the pancreatic neuroendocrine tumor that was on the head of his pancreas, one of the very first things the surgeon said to me at Cleveland Clinic when he came out of surgery was that Ron was very hard to get back together. In other words, he was so muscular that the doctor was surprised. He said even an area that was in question in his gut, his intestine, small intestine, that we wanted him to look at because there was something suspect there. He said that he felt along his small intestine and he'd never seen a muscular small intestine like that before. And in reviewing your case with a few other physicians, one thing that was mentioned is this is a surgery. This surgery came before bariatric surgeries. And this is the surgery that they now use for bariatric surgery.
Yep,
They
yep.
just don't take the pancreas, they
Yep.
don't take the liver, they don't take the spleen, but they
Bile
do
duct,
take
all
half
that.
the stomach. They do take some of that, right?
Small intestine, they take some.
So they take
Yeah.
the small intestine and then they reduce the size of the stomach for bariatric surgery. So this this Whipple procedure predates bariatric surgery and was what they are now the litmus test for bariatric surgery. So this now is done for lots and lots of people. It's not an uncommon surgery, the bariatric portion of it.
Yeah. Yeah.
But the Whipple procedure is still a very selective surgery for only a few.
Yeah,
a few
20%
select people,
of
right.
patients are accepted. And God, it's not a big percentage after that either that live after
But
that.
when you came out of surgery, it was so remarkable to me that he talked about how muscular you were, that you were difficult to get stitched back together. So because you're difficult to get stitched back together, they're rearranging your organs essentially. They took them out of their, anatomical
things around.
place
Yep,
that was
yep.
normal for you, whether it's normal for everybody, was normal for you.
I think once they get in, things change.
Yep, and they put them back. And in reviewing your case with other physicians, it was mentioned there's no way that they can enter you for this procedure and not touch your vagus nerve. And guys, if you don't know what the vagus nerve is, it's a cranial nerve that runs out of your brainstem all the way down. I mean, literally behind your esophagus,
That's
all the way
your
down to
main nerve.
to the bottom where there's a cluster of nerves where they end at the end of the spinal cord called cordia equina. So you cannot do this surgery, and this happens in a number of bariatric cases, where if the vagus nerve is traumatized in any way, touched, maybe things were squished back in you because you were too tough to get back together.
When I woke up after that surgery, oh my God.
And let's
Heart attack pain. I was ready to die.
Right, and let's be clear. Ron never had that kind of pain. Now, he had burping, he had hiccuping, and the hiccuping was nonstop for hours at a time. So he had pain. But what he didn't have is this thing that you would liken to what they call jackhammer esophagus, which is cardiac pain, right in the center of your chest.
Short and sternum. Bam.
And it just is
floors
crazy
me.
pain. And we think that was what was happening when you came out of surgery. Now, in hindsight, we think that's what was
exact
happening.
pain. Yeah.
But we didn't know why, because you had never experienced that before.
Never.
And that it was never once mentioned by the surgeons or the surgery staff or anything else. In fact, they felt it was quite odd that you were having this. They thought that you were having, that it was because of some anxiety you were having.
Yeah. I remember when I woke up and you're looking at me trying to calm me down, and I'm like, can't breathe, and I'm focusing. I know what's going on. Mm-hmm. I just barely can breathe, and I'm do something. But I think they just knocked me out. What happened? Thank God.
Yeah, because when they called me out of the recovery room, so there was...
They never told you anything about that?
No, there was tons and tons of people that day.
But they never told you about that?
No,
that
they just
up.
said you were having a hard time. They never said anything. They said you woke up and you were in a lot of pain, and they're trying to get your pain under control.
Okay.
And that it was going to be a while. So Ron was the very last patient. So the surgery started at... We stayed the night because we had to be in Cleveland at 5 a.m.,
5.
4:45
And
a.m.
line everybody up like the
And your
corral.
surgery started at like 6 or something, or at least to take you back to pre-op.
Yeah.
And then you were the last patient out, and you went straight to surgical ICU. And here, guys, just to let you know, that when we met with the surgeon, great guy, but when we met with the surgeon, we were told, Matt, you'd be in the hospital 3 days. 5 days max. Guys, we were 10, 12 days in the hospital. And then within 2 weeks,
Had to
Ron
go
was
right
back in the hospital.
Oh, so sick. So sick.
And they said it was dilaudid. They said it was this. They said it was that. But the pain never ceased.
No.
They put you in like a faja, which is like a compression garment, to try to see if that helped. And you said that made it actually worse.
Oh my God, I couldn't breathe.
It was crazy. I mean,
Living hell.
but we think now, because of all of that, looking back, because we had nothing to compare it to, because you didn't have this pain before you went in.
And they say
Not
something
that
about
kind of pain.
achalasia too, that people had these pains, but everything that I looked up, these people just like, oh, you know, like, oh, and I know what those pains are like, because I get those too. But the
Right.
heart attack where you're dropped and you're just like, oh my God, and to have that one day 12 times in one freaking day is unreal.
And that was just before we went for your
The
post-op visit to the
surgeon seen it, and the nurse seen it.
nurse practitioner.
I had
in
2 of
this-
them there.
Yeah.
Crazy.
And
From being so healthy my whole life.
right. And so, guys, this is the problem with this, is that we can't seem to get on top of it. So we can tell them over and over again, supposedly back in 2019, the same digestive disease guy we're seeing now at Cleveland said that you failed all your manometries. Guys, we never had that conversation. Trust me, we never had that conversation.
It just sucks to deal with stuff like that.
And
too.
so because we never had that conversation, we were sent to another specialist with no idea of why we were going. So we came back to Toledo in 2019 and talked to his primary care physician, who was convinced that this was just anxiety.
Yes.
And the primary care physician would not provide us with a referral to neurology.
No
Would
help
not
whatsoever.
provide us
Oh.
with a referral to rheumatology and immunology, even though that was the request of
So
Cleveland.
basically, just shop for another doctor.
Well,
That's it,
I'm
bottom
sorry.
line.
She just
It
screwed
was
the
horrible.
pooch. She screwed
Definitely
the pooch.
put us behind.
And years
Definitely
behind.
behind, yes.
Because she insisted, because her husband was a rheumatologist, we shouldn't see him. I mean, it was a
Yep,
very
that's
bad
fine.
thing
But that's-
to happen.
It was.
And it put us, I mean, from 2019 until 2024 behind, really. Because no one kept looking
Until I ended up getting sick.
until you finally
Horribly
said
sick.
you were
Just-
done. You were
And-
done.
Yeah, and then they found everything. Well, not everything, but
And right now, guys, his liver enzymes are still not
some
normal.
reason.
They're still high. So I think we both have paused that there is something on the liver, but they didn't do anything with it because it's not, quote, cancerous.
yep.
You know, we're stuck.
Yep.
We're really stuck.
So I'm gonna, I don't know, just keep plugging along.
I even
There's
reached
some
out.
days, but I think I'll plug along. Maybe share more of my story too, of daily routine that I need to do. You know what I mean?
Yeah, so this is the journey that you're on with this. I mean, it really is a journey. It's been a journey from
I try to get my health back.
yeah,
like I've
Ron to
always
get his
been.
health back. Not just sit here and complain about what we've been through, but kind of to give you guys a bird's eye view of what's going on from
Yeah,
this
just
side,
a circle, and it's just
Yeah. and let you in on Ron's daily life as he gets better and he navigates all this, because it certainly is. It
battle.
certainly is a
Such
battle.
Yeah,
Yeah.
this is a crazy battle. No, it's just more mental, a lot too. Just mentally, it's like this all the time, all the time.
But I don't know anybody. I mean, I've known you since we were 14. And even then, you know, I thought you were a great kid. We didn't have a lot of interaction, personal interaction, you know, just what you saw in school. And then when we got reintroduced many, many years later, and then finally took our relationship to another level, I've never known anyone who is so dedicated to what they do. And I think without that dedication and that mindset,
Of
yeah, you
being healthy is what you're getting at?
being healthy, just being a guy who perseveres at everything
Oh,
they put,
gotcha.
you
Not
know,
giving
put their
up.
mind into,
Yeah,
you
it's
know, put
crazy.
their mind into, not
Sometimes I
just
don't-
physical, but mental.
Yeah.
The mental part of this is the bigger task, really. And in some ways, I think it benefits you. I mean, personally, it definitely benefits you. But in this journey, you being so steadfast that you're okay, actually, I know you say you're okay because it's mentally, having had cancer, it's mentally exhausting to go through saying, I feel like shit, I feel like shit, I feel like shit. Because then your psyche starts to feel
Yeah,
like shit.
Negative. I don't, and I'm not a negative person. I'm
No.
stupid positive.
Yeah.
Even anything that's negative, I just try to look at it in a positive way and just keep plugging forward. But this time around getting sick, it just nipped me in the butt. You know what I mean? I just can't get out of this rut. I'm stuck in this hole that I can't jump out of, and it sucks because I'm doing everything I possibly can.
You are.
Eating clean to eating whatever crap just to get something in me, just any kind of nutrients, any kind of sugar, any kind of carbs to just stay afloat.
Yeah.
You know, so it's yeah.
Guys, I have to argue with him that he just needs to eat. Sometimes he'll say, I don't want to eat, you know, he'll want candy for the quick up because his body is, you know, his sugars have
depleted
been
so
in the
much.
50s.
Yeah, because my sugar drops too because I can't eat. Yeah.
So he'll say, no, I don't want to eat the candy because, you know, and then he'll turn around and get candy, or he'll say, I don't want to eat that because I don't feel good after I eat it. And it's a struggle between getting any food in or getting no food in. And sometimes you have to choose the Pop-Tart just to be able to get
Something
in you. Because that's sometimes raw. It seems like sugar is the only thing that stays because your body needs it right at that moment because your sugar's low.
It drops too. God.
That's what I mean. I think your body goes, oh, okay, sugar, we'll take that.
Yep. It does.
But when it comes to eating healthy and your digestive system working well, it really hasn't worked well for a long time, but definitely since the Whipple.
No, now it's unbelievable. I am so shut down.
Yeah, and you
But
have
I
to
think-
eat much smaller meals. I mean, anybody who has a bariatric surgery is gonna, you know, this is gonna resonate with them.
For now, I'm hoping I can eat better, but whatever. I mean, I take whatever happens. I'm not young anymore, and I think going through this is.
Absorption
Definitely.
gets a lot more difficult when you get older, anyways.
Oh
so-
yeah, and your digestive system slows down. Everything just slows down.
Yep. So now we've got
So we'll
that
get through
problem
this.
on top of it.
So I'll start sharing more of my story, and yeah, just start sharing my story. Still working out if I'm okay.
Perfect. I mean, that's really what you have
This
to
is
do.
what 6. This will be my 7th week.
Yeah.
Maybe I'll show something too what I got, even though it's whatever. It's a mess, but I'll do what I can. You know what I mean? And keep plugging away. You done? You good?
Yep. So, guys, I just came on here today to get him to kind of share a little bit more of the backstory, kind of talk about what it's a little bit like for
Yeah.
the two of us rather than just the one of us.
Yeah. Kind of wanted to see both sides of everything. You know what I mean?
Yeah.
I think that helps. And then continue from there.
Right.
Okay. The end. See ya. Click.
Cut.